This is ACL avulsion injury, and this is 1 day after injury. We are checking the integrity of ACL and meniscus is intact. We have to remove the fat pad in anterior to the ACL avulsed fragment so that in this technique we can check the reduction properly. And now we are removing the hematoma and the collected small bone fragments in the crater of the avulsed area so that the reduction can be properly done when we fix it. Whenever we are doing this ACL avulsion fixation, we have to do the middle portal so that the reduction can be maintained in the middle portal and we can work from either anterolateral and anteromedial and view in the alternate portals. The plan is that we have to take bites, one in the anteromedial one from the anteromedial and one from the anterolateral side, and make a cinch knot and make two tunnels, and then pass the thread through the tunnels. And whenever we take bites from the ACL, avulsed ACL, we have to use the shoulder scorpion, not knee scorpion, so that the mouth of the scorpion opens very widely and the bites can be taken throughout the ACL fragment, at least more than 60% of the ACL, so that the bulk of the ACL is covered. We have to make sure that we have to reduce the fragment, and then you can see that we have taken it out from the anteromedial. Now we are shifting the scope, viewing from anteromedial, taking the bite from anterolateral portal, and simultaneously we are doing the cinch, and then you can see both lateral and medial portal we have put two threads, and now we are trying to reduce it from the central and middle portal from the patellar tendon. This is the jig we are using. We have to make first we have to drill the guide wire, and then we have to over drill with the 4.5 mm drill bit so that this suture retrieving will be very easy. We have to make sure that we have to leave a space of at least 1 centimeter between the both the tunnels so that when we make the suture, when we tighten it, we can properly compress it. And here when we do the tunnel, we have to make sure that this is sufficiently anterior and medial to the fragment or on the fragment so that when we compress the sutures along with it makes it achieves two things. One is to compress the fragments. Second thing is to give tension to the ACL. You can see that we have now pulled both the threads from both the tunnels like a suture bridge, and we are checking the integrity, just pulling the threads. We have not yet tightened it. We have to now reduce it properly and then make this one of the loops come uh, near the other side, other loop, so that we can either make simple knot or we can use button to fix this both the threads. If you remember, whenever if you have done single tunnel, sometimes when we extend or flex, these fragments are flimsy and as a small fragments, it pulls off. You can see now we are checking this in extension. The reduction of the fragment is very nicely maintained and ACL tension is very nicely maintained. That means this heals very well. Otherwise, many times we would have seen this heals in some of the bits and parts. At some of the areas, the small fragments remain like that. In order to avoid those things, this technique helps in giving the compression along the bridge and pressing the fragments. You can see this is the final tightening and final tension of ACL. If you have liked it, please like it. Thank you for watching this video.